My name's Yasser, I'm a senior lecturer in pharmacy practice and an advanced specialist pharmacist, and I'm with Amir today. Amir is a postdoc and he's also the videographer and editor for the MicroPharm channel. Today we're going to do something a bit different. We're going to go through reading out mean tweets about pharmacists, and then following on for a video on his channel, we'll be reading out mean tweets about PhD students.
I'm excited for this. This is going to be fun. I've been waiting for this for a couple of months, so I'm finally allowed to roast him about being a pharmacist.
The main thing is I haven't seen any of them, but I know they're all going to be about glorified shopkeeper or what does a pharmacist do, but maybe it can be an educational video where I can answer those questions and dispel all of the myths.
You kind of ruined a little bit of it, but I've got some interesting ones, hopefully, that you guys who are watching might not have heard of. So let's see if you guys enjoy it as well as seeing him moan and complain about being a pharmacist. So shall we start?
Yeah, let's start.
Alright. So sort of very light, very, very simple. I was happy once, and then I started pharmacy school.
This I see a lot of. And although some part of me finds it slightly funny, I also don't think it's that bad, but maybe I'm a bit biased because I'm a lecturer. One thing about pharmacy school, we don't really refer to it as pharmacy school in the UK. The pharmacy degree in the UK is 4 years, as opposed to a lot of degrees out there that are 3 years. So a lot of friends will be studying different courses, and you have that extra year at university. And there's loads of ways for you to fail within the course because it's so expansive. I do agree with that. I also agree with the fact that in other countries, it's actually the process is a lot longer, particularly from my understanding in the US. And a lot of students from Canada, the US, would come to the UK to study pharmacy.
Interesting. And I remember when you were at university doing your degree, you had a lot of oral examinations that if you failed on, that would be a problem, that you have to repeat the year. Whereas other people might have some coursework perhaps that could just retake in a few weeks, right?
Those are called OSCEs, and everyone hates OSCEs. And the reason for it is because we don't focus on it so much now, but there used to be things when I was in pharmacy school where essentially you make one mistake, you fail the entirety of that exam. And that's something that will always stand within OSCEs because of the fact of how risky it is for people to be making those mistakes in practice. That's something that was just terrifying. You make a mistake in an exam, you could say the worst thing in a multiple choice exam, and you will only be penalised for that 1 mark.
Interesting. Yeah,
Imagine if you gave the wrong dose for a multiple choice exam and you failed the entire exam. That's what it's like.
So even though this was supposed to be mean comment, I think that's also probably true to an extent. But let's go to the second one. So what do pharmacists really do? They just follow what the doctor says on the prescription sheet. That's all you do. All you do is just look at the prescription and then just say whatever the doctor says, right, just go get that.
Yeah, so this is a very common misconception. And the reason why it's such a common misconception is the fact that people don't appreciate the fact that we're experts in medication. And essentially, quite often, you're giving advice about this medication. Pharmacists are a lot more involved in the decision-making process with regards to choosing a medication, with regards to ensuring that the correct medication is being prescribed at the most appropriate dose, for the most appropriate duration. So there's so much involved with regards to the medication. There's also so much involved about medications interacting with other medications. So
agreed, yeah.
We take that into consideration as well. But I hear that so often, so often, and you'll hear it from family members as well. People don't understand. They don't understand what we essentially do. Particularly in community pharmacy, it's very poorly understood. Right. But the pharmacist is there essentially to make sure that medication is safe for you.
In many different ways, I presume, right? You said a good thing about the notion of dosage, duration. A lot of people don't think that, okay, you're taking a certain medication, here you go. But you might not need it for too long or too little, or there's so many parameters and variables that you have to take into account.
Is it okay with the other medication you're on?
Yes.
Is there a better option? Why are we treating your blood pressure with this medication?
True.
It's outdated, based on poor
Agreed.
evidence base.
Yeah.
So lots to consider, definitely.
So if you think that, you can't anymore now. Because yes, it's dispel the rumour and the myth.
Another thing is, I'm a prescriber, and a lot of pharmacists are prescribers, and the entire new cohort of pharmacists will be prescribers.
Oh, really?
And that's within the course.
Oh, wow. Oh, that's something new. I remember people went on to the independent prescriber course. But that's going to be part of pharmacy.
Part of this. It's already
Wow.
started, so we already have the first cohort that once they graduate, they will be prescribers as part of their entire degree.
That's interesting. Why did I do a PhD then? So, third comment now. Linking to what we just said, and it's the life of a pharmacist is basically, in my opinion, not in my opinion, read the medication that's needed, go to the shelf, grab the medication, put it in the bag, and give it to the patient.
So,
First of all, it does sound like it's true, but it's not. Right?
Yeah. Main thing is, the majority of what you've just said there isn't actually done by the pharmacist in many cases.
Fair enough.
But that's not to say that it's not an important part of the entire decision-making process. So, quite often, whilst you're defending what you're saying, you can offend someone else in the team.
True.
So someone else could be doing that in the team, and it's very important for them to be dispensing the medication. But quite often, pharmacists don't dispense the medication. So we don't actually pick the medication, label the medication, look at the prescription in accordance with that. We do that at the end. We do that checking process at the end.
Okay.
So it's important for someone else to do it, because then you can ensure it's correct with a fresh pair of eyes.
Interesting.
Just to add to that,
Yeah.
in the hospital, most of the checking is actually not done by pharmacists.
Oh, really?
Most of the checking is done by a qualified pharmacy technician, a registered pharmacy technician.
So what would be your, not to go into detail, but compared to your hospital and community, you mentioned about community now, what would be your main duty within the hospital side of the medication part of being a pharmacist?
Yeah.
Go.
Good question. With regards to most hospital pharmacists, the majority of hospital pharmacists work on the wards.
Right.
So they work closely with the medical teams to speak to different patients, see what medication they're taking at home, see what they've been prescribed at the hospital. Is it appropriate? Again, this process can be done by a pharmacy technician, and it's the pharmacist's role to clinically check that everything that's been prescribed as an inpatient is appropriate, that you've considered all the interactions that could occur with the patient's medication they're already on, and that they go well together, essentially.
Right.
You then have to order medications that are required whilst they're in the hospital.
Right.
You have to make sure all of the medications are appropriate with regards to how their kidneys are doing, how their liver's doing.
Yeah, good point.
And then, after you've ordered that medication, that whole process, the dispensing process, is done by someone else.
So it's a lot compared to what I've just said.
And it's a lot different as well.
Yeah.
So I think that means in the future, all the pharmacy technicians are going to get the slack.
Yeah.
The same criticism that we receive.
So you heard it here first, right? This is going to happen in the next few years. But this is actually one of my favourites. Alright, so comment down below if you think this is a good one. But they say many jobs have very transferable skills, right? But I do agree that pharmacists and shopkeepers have a lot in common, don't they?
Yeah. So if it comes to telling you where something is,
yep, transferable skill, right?
Transferable skill.
You know where certain medication is. Somebody knows where the milk is and the cereal, right? So technically, is this transferable skill?
Can milk kill you?
Probably not. I guess, hypercalcemia, maybe.
Yeah.
But no. Although it's a quite a notorious, mean comment. In a nutshell, explain to myself as well as the audience, where did that theme come from of being a glorified shopkeeper, especially with community pharmacy, I presume?
Yeah.
And why is it not? Why are you not a glorified shopkeeper? Because I know you're not.
Yeah. So, really important question. I'm not going to fully go into it because I answered it really well in the last question. But really, it stems on the fact that people don't understand what pharmacists actually do. They don't understand the importance of interactions. They don't understand the importance of reviewing doses. They don't understand how expansive our knowledge is with regards to medication.
Agreed.
and they don't understand that in many cases it makes up a component of everything a doctor has to learn.
True.
So I would never, and I say this quite often because I see pharmacists do this, I don't criticize doctors about if they struggle with grasping doses for medication or if they get things wrong. I don't think it's a bad thing.
No, fair enough. Yeah.
I say I've done 4 years of this and I still struggle, and it's part of my day-to-day life. If you struggle, you also have to consider the diagnosis. You have to consider the differential diagnosis. You have to consider what tests you have to. You have to consider what tests you have to request. You have to consider the monitoring. I can help with the medication.
Yeah, no, that's genuinely a really good way to look at it. I never thought of it like in terms of the dynamic between a doctor and a pharmacist, especially in a hospital. You know, you don't appreciate how that comes across. Which actually leads me on to a nice segue, which is the next one, which is what are pharmacists? Failed doctors.
Yeah, that's that you hear.
You heard it. Comment down below. You heard it, haven't you?
You've definitely heard it. I think a lot of us have heard it. But again, it just stems back to the fact that if you don't understand what a pharmacist actually does, you're going to call us failed doctors. If a pharmacist is not a prescriber, they would focus more on the appropriateness of the medication, the dose of the medication, interactions, contraindications, ensuring that it's supplied in the appropriate formulation. We're going to consider all of that. And we're going to have limited involvement in the diagnosis.
True.
So if a lot of your role doesn't involve what a doctor does, and you're both required to do that, then
very good defense.
It's a poor argument because you're not appreciating the roles of the different members.
Agreed. Yeah.
So I think it just stems back to education.
True. I remember I used to hear it a lot when I was in university, and used to have a lot of friends who were pharmacists, and you know, a lot of the jokes were like this and a lot of the comments were like this. But then when you appreciate what happens in a hospital, definitely, then you realise how essential. You mentioned this in one of the videos about being a multidisciplinary team, how everybody has a key role that they need each other for, like the nurses, the doctors, the people who are on the ward, the pharmacists, etc. So, you know, it's true.
I'll add to that as well. If you want pharmacy to be a rubbish career, if you want to be criticised for not having good clinical knowledge, if you want to be criticised for being a glorified shopkeeper, you can do that. You can let go of those skills. And
Very
I
true.
see people do that, but you only ruin it for yourself. And the pharmacy career, so I've seen so many people that are 20 or 30 years into their career that have lost that ability for clinical skills and appreciating the nuances about guidelines, about appropriateness of different doses, or really appreciating what medications actually do. You can let that side go.
Fair enough, yeah.
However, all of the roles are changing. There are a lot more clinical roles. So you're not going to be able to keep up with the way the pharmacy career is progressing.
Interesting. It's like you, not forced, but in order to keep your role, you have to keep up to date with clinical knowledge or, you know, medication knowledge. I remember the book they have, that BNF is always updated, right, with new things and new guidelines. So it's kind of like impossible not to be up to date if you want to keep your job to a certain point, right? Even depending on which role you are, you need more of a certain form of knowledge, whether it's clinical knowledge, medication knowledge. So it's so to think one, you failed doctors is wrong. Even I would put my hands up. But to say that if you want to keep your job, you still have to learn a lot on a day-to-day basis, or you know, every month and every year you have to update what you know. Well, yeah, that's something interesting to think about. We've got a few more. You can tell they're not super mean, because I didn't want to hurt Yasser's feelings.
I'm ready for super mean as well. I was expecting.
Do you know why? Should I tell you the honest truth? Is that actually I work for him, so if it was too mean,
get paid next
then
month.
I might not get paid. So I want to have to balance, you know, being here and not hurting his feelings too much. But comment down below, or you know, send Yasser on Instagram a message to see if you got any other mean comments you think are super severe that we should do and react in another video. Because you know, if you said it, then I didn't lose my job because you've said it, not me. So that might help in my sense. But we've got a few more. Another one related to it is, what is another term for pharmacy school? BTech medical school.
Oh yeah. Except
it's a new one.
it's
But
a new one.
Yeah.
It's a new one. One criticism that junior doctors often give me about their time in medical school is the fact that they lack an expansive module or several modules on pharmacology and therapeutics and understanding how they work. So that BTEC medical school really helps them out whilst they're on the wards. So again, it's nothing to say about doctors.
Or BTECs, by the way.
Or BTECs, that's true.
Yeah. No.
What's wrong with BTECs? I didn't say that.
Just to clarify, in case anyone does, it's just I found it somewhere else. So there's no disrespect to BTECs, but you might appreciate the point of pharmacy school might be seen and perceived as a lesser form of medical school, but it completely isn't.
There's so much within medical school that has to be appreciated. So just the art of diagnosis, and this is something that I came across in my prescribing qualification. It's so complicated that I realised why a lot of that goes into how they construct a medical school program. A lot of anatomy and understanding anatomy. We don't have that expansive background of knowing anatomy. So there's so much to consider in terms of medical school that often a proportion of it, and sometimes a small proportion of it, goes to understanding how medications work. And pretty much most of it, in terms of our degree, is understanding how medications work and the impact they have on the body.
Yeah, that's it. You don't, or somebody who's outside of the field of being a pharmacist, don't perhaps appreciate how much knowledge is in the modules that you've probably learned, not just in your independent prescribing course, but just your degree alone. And yeah, to say it's a disrespect to BTEC and medical school to say.
Yeah, it's a disrespect to everyone in the
fair,
field,
yeah.
and quite often the comments come from someone that's not in any of the
Yeah,
fields. So
to be fair, or maybe somebody who just thought of these comments.
Which is you.
Yeah, so
Nah.
don't hate me, please. It was for content, right? That's mine.
Made it
Right?
for the content.
It was for content. So we've got two more. And then this one, I'm not sure whether it's something that happens too often. So let's find out when I tell you. But what infuriates a pharmacist a lot is when they find out a nurse has spent 30 minutes looking for medication to find out that they're already given it to the patient. Does that happen quite a lot in hospitals, or is that a theme? Is that a meme or anything like that?
To find out they've already given it.
Yeah, so they've harassed the pharmacist and made the pharmacist worry that where's the medication, to only find out they've already given it and they forgot about it.
Okay, so I know where this is stemmed from. So quite often you'll be asked to order a medication,
Right.
and then that medication is brought up to the ward. Because you're ordering so many medications at the same time, they often come in the same bag, and they're put into the treatment room.
Right.
And sometimes you get harassed, but it was sitting in that bag with the rest of the medication locked in the treatment room.
Okay.
So it was there all along.
Right.
But again, that could easily fall down to communication,
That fake error, perhaps, and stuff like that.
Yeah, but it happens so often, and
Yeah.
because you're working in such a fast-paced environment, people can get annoyed. You see it happen, but again, we're all there.
Has it happened to you when you've been in hospital? Have you been
Yeah.
infuriated to the point where you've either got super stressed about where is a certain medication? Because I presume some are high priority, right? Some patients need something like straight away, and if it's not given, it can cause a problem. So have you had that in your scenario?
I've had one example, but it's nothing to do with that.
Okay.
But it's understanding the whole MDT process. So quite often, when pharmacists write on drug charts within the hospital, they write in a green pen.
Oh.
So it kind of looks like you're just criticising the crap out of anything that's been prescribed, and you're like correcting this and correcting that. So what tends to happen is, which is a really bad habit for other healthcare professionals, tend to ignore the green pen because there's so much criticism from the green pen.
Okay, interesting.
So there was one patient in particular that I said that I put in green pen, and I highlighted it, made it very clear not to give the patient the next dose because they have a high plasma level of that particular drug in their blood.
Right.
Spoke to the medical team, spoke to the nurse, let them know.
Right.
It was handed over to the night nurse. And then I was just like, I'm like advertising night nurse. it was handed over to the nurse that was covering the night shift, and then that nurse, it wasn't handed over, to the nurse that was covering the night shift, and because of that, the patient was given the dose. And because of that, there were so many implications, there were so many things we had to do to report that error. We had to manage possible overdoses as a result of that. All of that is just because ignore the green pen.
Interesting. Well, we look at when you're a lecturer and I've been lecturing for a while before, and you're marking students' coursework, and then in a clinical setting, how that's ignored is a bit of a scary scenario to me.
Yeah, definitely.
Hashtag not sponsored by night nurse. Because they don't get problems. Right? Never know. One day.
Never know. I'll take it.
Okay.
No, I won't take it.
I called it first. Who called it first? I didn't. Even though I have a PhD channel, we can make it work somehow. Right? Last one. Similar to the degree. So why is pharmacy degree so hard? And this actually sparked a new video idea. So I'll tell you the video idea in a bit. I think you'd like it as well. We won't tell you. So why is the degree so hard? Because you spend half the time learning how to spell all the medications.
That's true. Yeah. That's true, meaning that you have to appreciate how much you pick up about spelling medication. Sometimes you'll see a medication that you haven't even looked at for like 5 years, and you just look at it and you say, that's wrong.
Yeah.
I don't know what it is. There's one letter's off. And then you check it up and you're right. And that's just because you've just picked it up somewhere.
Yeah, I'm just thinking, like, all the medications that I've seen in my lifetime, and think, if you were to ask me to spell them now, I wouldn't be able to.
Now you look at some of the medications, though. There's this whole class of medications called biologics. Have you heard of biologics?
Oh, yes, yeah.
Those are just like...
the immunotherapies, yeah.
Adalimumab.
Mepolizumab, So the video, as you can probably tell now, is where I quiz Yazir on some really hard spellings of medications and see if you can win a certain point. I think that would be a good idea, actually.
Yeah. I'm
down for that. Yeah. So, unfortunately, I don't have any more severe ones. But as I said down below, do comment if you have any mean comments that I'm too scared to ask them because I don't want to lose my job, of course. But if you ask it, then...
And then in the description box below, you'll see the next video that will be on Amir's channel. Thank you. I'll see you in the next one.